Now let's discuss injuries and trauma. First aid providers are often called to assist with injuries and trauma. If a person is bleeding, always use personal protective equipment prior to caring for an injured and bleeding person. Applying direct pressure is the most effective way to stop bleeding from a wound. Use a dressing in your gloved hand to apply firm and direct pressure to the injured area. Continue holding pressure until the bleeding stops. You may need to apply more dressing on top at first, and at times there might be more than one wound to deal with. Very small wounds such as scrapes can heal more rapidly by using an antibiotic salve. Ask the person if they have any allergies before applying. Thoroughly wash minor scrapes and abrasions with soap and water before bandaging. When direct pressure does not control bleeding, a tourniquet may be required. Follow these steps when applying a tourniquet. Put on personal protective gear. Apply tourniquet 2 inches above wound. Tighten until the bleeding stops. Record the time the tourniquet was applied. Call 911. Stay with the victim. Teeth may be broken, chipped, or completely knocked out of the mouth. Always use gloves when handling another person's tooth. Sometimes teeth can be replanted and should be transported with the person to the dentist or medical facility. Always handle the tooth gently and avoid touching the roots. Gently wash the tooth with clean water, but do not scrub the tooth or roots. A tooth can be taken in milk, saline solution, or under a cooperative victim's tongue because the victim must see a dentist or medical provider immediately. If the tooth is loose, have the person bite down on a piece of gauze and call a dentist. When dealing with a nosebleed, be sure to wear personal protective equipment and eye protection. Persons with nosebleeds often swallow a fair amount of blood, which may result in vomiting. Pinch both sides of the nostrils between the bony portion for 5 to 10 minutes. Hold another 10 minutes if bleeding continues. Seek medical care if bleeding continues, there is trouble breathing, or signs of distress. Puncture wounds and impaled objects pose a special risk to the injured person. Puncture wounds may penetrate deeper than is apparent and injure sensitive structures such as nerves, muscles, tendons, or blood vessels. These should be controlled with pressure and further medical attention. Impalements must be left in place and stabilized with gauze. Transport victim to the emergency department. Common eye injuries can result from direct blows, foreign bodies, or inadvertent scratching of the eye. Symptoms include immediate pain, tearing, changing vision, and redness. Bruising and bleeding can occur. Simple irritants can be flushed with water. Chemical exposure should be flushed with copious water while also contacting 911. If a more serious injury is suspected, bandage and contact 911. Head injuries can accompany any traumatic event. Signs and symptoms of a head injury or traumatic brain injury include confusion, headache, nausea, vomiting, memory loss, sleepiness, loss of balance, seizure, and loss of consciousness. A person demonstrating any of the above should be further evaluated by a physician. Spinal injuries can occur from various accidents and physical activities. A high index of suspicion must be maintained, and efforts made to protect against further injury to the spine and spinal cord. If you are older than 65, you have an increased risk for spinal injuries. Bike, motorcycle, and car accidents and falls are other increased risks. Pain in the midline of the neck, numbness, tingling, weakness, intoxication, and substance abuse all increase the chance for spinal injury. Injuries to the spine can be unstable. Unnecessary movement of the victim can result in spinal cord injury and permanent paralysis. Therefore, you should always avoid bending, flexing, or twisting a person's neck or head. Bone and joint injuries are common, and physically active people and those participating in sports are more likely to suffer these types of injuries. Sprains occur when excessive force or abnormal motion stretches a joint beyond a normal degree. The first aid care for both sprains and broken bones include the following. Ensure the scene is safe and wear personal protective equipment. Apply gauze to any open wounds. Apply an ice pack to the injured area for up to 20 minutes. Encourage further evaluation by a healthcare provider and avoiding use of the injured part. 911 should be contacted if there is an open wound over the joint, abnormal position, or bent extremity, and obvious joint dislocation. Please review the Bone and Joint Injury section in your provided handbook for important information regarding bone and joint injury. Do not attempt to correct a compound fracture. Use a splint to protect the injured extremity. It can be made using a magazine, wood, or rolled up towels. Use a towel or cloth as padding. In the case of an amputation, ensure scene safety. Get the first aid kit and put on personal protective equipment. Activate the emergency response system by calling 911. Apply direct pressure with gauze to the bleeding area. Locate the amputated body part and care for it with the following steps. Stay with the injured person until more skilled providers arrive. Follow these steps when caring for an amputated part. Wear personal protective equipment. Locate the amputated part. Gently rinse with clean water. Wrap in gauze and place the amputated part in a plastic bag and seal it tightly shut. Fill another bag with ice and place the first bag with the amputated part in this bag and seal it tightly shut. Write the person's name on the bag. Transport both the amputated part and the person to the hospital. In the case of a small burn, make sure that the source has been dealt with and the scene is safe. Wear personal protective equipment and get the first aid kit. First, rinse the burn in cool water. Next, apply antibiotic or burn cream as long as they are not allergic. Cover the burn with a clean, dry, non-stick dressing. Lastly, have the victim follow up with a healthcare provider. Do not apply ice to a burn. Call 911 if any of the following has occurred: a large burn, a facial burn, breathing difficulties, a fire, or the possible exposure of carbon monoxide. In the case of a large burn, ensure scene safety. Call 911. Put on personal protective equipment and get the first aid kit. Remove any restricting clothing and jewelry. Cover the person with a dry blanket to prevent heat loss. Assess for signs of shock. And offer reassurance. That concludes the injuries and trauma lesson.